Part A. In this part of the test, you hear two different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Rongamai Wenua. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning.
Good morning. What's your problem?
Well, I have a headache and pulsatile tinnitus. For the past 3 months, I've been getting severe headaches, and almost daily. I'm getting pulsations in the head with heartbeat sounds.
Exactly at which point of your head do you feel pain?
On top of my head.
Are you getting nausea or vomiting associated with the headaches?
No, doctor.
Is there any previous history of headaches?
No, doctor, but apart from last 3 months.
What's your age?
44, doctor. When I speak on the phone, I get weird sounds in my left ear. I get pulsating sounds only in left ear.
When did this problem start, actually?
Well, actually, the ear pulsations began following a flight trip to my native place.
Is there any drop or change in hearing?
No, doctor. But I had dizzy episodes in the past with nausea being imbalanced at times.
Is there any change in your vision?
No, doctor.
Well, do you smoke or drink?
I do not consume alcohol, but I used to smoke 1 pack a day, and now I have completely stopped it.
Have you had any previous illness or surgeries?
I had skin cancer on my arm and back. I am a kidney donor, so I had a left nephrectomy, C-sections, mastoidectomy, laparoscopy, and temporal arteritis.
What medications are you taking?
Tylenol, Excedrin, and a multivitamin and probiotic.
Are you allergic to any medicine?
Yes, to codeine and penicillin.
Tell me your family history of illness.
Well, my father has a cancer, hypertension, and heart disease.
Your physical examination shows your blood pressure at 120/78, pulse 64 and regular, and the temperature is 97.4. Cardiovascular test shows regular heart rate and rhythm without murmur. There is an old mastoidectomy scar on your left ear. Weber exam is midline. Grossly hearing is intact. You have pulsatile tinnitus. Left ear with eustachian tube disorder as the etiology. There's also a possibility of normal pressure hydrocephalus, deviated naval septum, dizziness, probably due to possible Meniere disease. I would recommend you to start a 2-gram less sodium diet. I am ordering a carotid ultrasound study as part of the workup and evaluation. Since your disease is related to eustachian tube, I'm prescribing Nasacort AQ nasal spray, 1 spray each nostril daily. You use the hearing protection devices at all times. I will recheck you in 3 weeks. If the pulsatile tinnitus does not improve, then I would recommend other treatments, including myringotomy or ear tube placement. You have to undergo for an audio and tympanogram prior to the treatment procedure.
Extract 2, questions 13 to 24. You hear a physician talking to a patient called Sampanguita. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning.
Good morning. What's your problem?
Well, doctor, I have itchy red rash on my feet.
Okay, what's your age?
21, doctor.
Tell me if you have developed any associating symptoms or signs.
It is tingling persistently, doctor.
Since how long have you had this problem?
For the past 4 weeks.
Exactly on which part of your foot you are getting this problem?
Right great toe, right second toe, right third toe, and right fourth toe. Often the onset of itching starts after removing sweaty socks.
Do you drink or smoke?
I do not smoke, but I do drink.
Have you had any diseases in the past?
Well, I had chicken pox and frequent ear infections.
You had any surgeries as well?
I have surgical ear tubes.
Do you take any medications?
No, doctor.
Are you allergic to any medicine or substances?
Well, I get a severe rash when I access adhesive tape.
Any of your family members have any history of illness?
My paternal grandmother is having cataracts, and my maternal aunt has migraines.
Well, your physical examination reports show blood pressure 110/64, respiratory rate is 18, heart rate is 66, and temperature is 98.6. Lower extremities is warm to cool, proximal to distal. The dorsalis pedis artery pulse palpable bilateral. Posterior tibial artery pulse palpable bilateral. No edema observed. Varicosities are not observed. Right great toe, right second toe, right third toe, and right fourth toenail show erythema and scaling. Muscle strength is 5 out of 5 for all groups tested. Muscle tone is normal. Inspection and palpation of bones, joints, and muscles is unremarkable. You have developed tinea pedis, a fungal culture of skin from right toes. KOH test shows no visible microbes. I'm prescribing Lotrimin AF 1% cream to apply 4 times a day, and Griseofulvin 250 milligrams PO once in 8 hours for 4 weeks.
That is the end of Part A.